This is the malignant cell. Why? Because here is the malignant cell. You can compare it with the normal one. This is hyperchromatic, irregular in shape, polymorphic cells. This is all malignant cell. Why? Because it's not the normal one. It is irregular in shape, it's hyperchromatic, crowding, and it's formed in papillae. Again, we can see here necrosis and hemorrhage. And this is the malignant cell hepatocellular carcinoma, can lead to necrosis. And if it is ruptured, it can lead to hemoperitoneum. This is irregular in shape mass seen in the liver with satellite nodules. In this case, they found it is a cholangiocarcinoma. As we said, hepatocellular carcinoma will have bile accumulation inside the liver, not like the cholangiocarcinoma. And also the alkaline phosphatase will be raised, and the direct bilirubin will be increased also. Cholangiocarcinoma, on the other hand, seen in the developing countries. Why? Because there is infection, most likely with the liver flake with them. So cholangiocarcinoma will be one cause of it, could be the liver flake. This is the carcinoma seen in glandular form, this one, or trabeculae. This is the normal one. Sometimes this could be due to metastatic, not only primary from the liver. It could be في شيء يضحك. This could be metastatic from other organ, not only primary to the liver. It could be what? Could be from the breast, lobular carcinoma. In this case, we can see well circumscribed multiple nodules of varying in size, larger one and smaller one. In this case, we can suspect it's a metastatic. Why? Because it's multiple, not like the previous one, ill-defined, one larger nodule and the others are satellite nodules. No, here we have multiple nodules, no dominated nodules, and multiple in size. So this one will be suspected for metastatic from where? From maybe the breast, if it is a female, or from the colon, most likely. Again, here we have a multiple nodule, but here, not like the previous one. The center is different from the previous one. See? Here is necrosis in the center, and the nodules are serrated like a cauliflower. So in this case, most likely due to a metastatic from the colon. So it's adenocarcinoma, metastatic adenocarcinoma. Again, we can see metastatic adenocarcinoma in the liver. Multiple nodules are seen. Microscopically, metastatic infiltrating ductal carcinoma from the breast. So it's not only from the colon, could be coming from the breast, either ductal or lobular carcinoma. Again, necrosis, we can see pale yellow necrosis in the liver. This is a necrosis and lobular collapse of the normal liver. Here we can see multiple infiltration of the inflammatory cells into the hepatocyte. The inflammation can cause destruction of the hepatocyte. This most likely seen in viral hepatitis. The most common one is the viral hepatitis B. It can cause it. How we can differentiate between the others variant of viral hepatitis? By serology, not by the microscopically, because all of these can cause the same picture. It's only the serology can be differentiated between each one. This one, hepatocyte affected by the viral hepatitis, causing significant necrosis. First, the necrosis will be ballooning and degenerating of the hepatocyte. Then, after that, the hepatocyte will go into shrinkage and form an eosinophilic accumulation inside the cytoplasm, like this one. So first one will be ballooning and degeneration of the hepatocyte. Then the degeneration of it will be accumulated as a pink granular cytoplasm. This is in case of hepatitis C, leading to chronic liver disease. Again, we can see inflammation, scattered inflammation, sometimes necrosis and degeneration of the hepatocytes. Again, we can see lipid vacuole inside it, so the patient have already fatty liver. Here we can see a hepatitis C patient with fibrosis and some fatty changes and some scattered inflammatory cells. Again, by serology you can differentiate between each viruses. This is a trichrome staining. It stained the fibrosis inside the slide. So by H&E you cannot detect the fibrosis. You have to do a special stain called trichrome stain. This will demonstrate the fibrosis as a blue stain. This is all about the liver. Any question about the liver? The second topic is about the pancreas. Here is an abnormal picture of the pancreas. There is hemorrhage and necrosis seen in the pancreas. First, the pancreas, you have to know the normal structure or the normal shape of the pancreas to know the abnormality in each one. Here we have hemorrhage and necrosis. This one. The pancreas having in the superior aspect the stomach, and the lateral one is the spleen. Here we can see part of the stomach, and this is the spleen. Here is the head of the pancreas, and here is the tail. The body in the middle of it. So there is area of hemorrhage seen here. If there is destruction or abnormality of the pancreas, what is the most common or most likely serology will be done is the serum lipase will be elevated. Most likely if acute pancreatitis is there. So this is an autopsy of a patient after dying. This is a pseudocyst. Why we call it pseudocyst? Because it's not having an epithelial lining. So this is the liver, and here is the spleen. So the pseudocyst from the liver to the spleen. It was a huge one, containing hemorrhage and debris, necrosis. This is a case of acute pancreatitis. We can see necrosis of pancreatic parenchyma. Cannot see here the normal one. So necrosis, collection of neutrophils, and fat necrosis also. These all can be seen in acute pancreatitis. Neutrophilic infiltration of the pancreas can cause fat necrosis, as we said previously. So again, serum amylase and lipase will be elevated in this case. We can see here hemorrhage due to acute pancreatitis. This is a residual pancreatic acini in a background of what? Hemorrhage and inflammation. If the the inflammation goes to island of Langerhans, the patient will be presenting with diabetes. This is fat necrosis of the pancreas. This is the same pancreas, but we have cut it longitudinally. If any question, please ask me. Again, مرة ثانية. Not only acute pancreatitis can be due to viral, it could be due to drugs, hypertriglyceridemia, hypercalcemia, toxin, or blunt abdominal trauma. Again, we can see necrosis. Adipocyte goes into fat necrosis and inflammatory cells with debris. Here is the island of Langerhans. These are collagen stroma, and here is island of Langerhans infiltrated by acute inflammation. As we see, if there is an inflammation or destruction of island of Langerhans, the patient will be presenting with the diabetes. Not only the inflammation could be due to the pancreas itself, it could be due to obstruction by stones from the biliary tract. This is a collagenous stroma. This is after a chronic pancreatitis. The fibrous stroma, like here, it goes into fibrosis. So this is the fibrosis due to the chronic inflammation in the pancreas. This will lead eventually to diabetes. Here, a fibrofatty or adipose tissue replacing the pancreas, only remaining the island of Langerhans. This is the pancreas. Most commonly cause of carcinoma in pancreas is the adenocarcinoma of the head of the pancreas. So if there is a carcinoma of the head of the pancreas, it will be obstructing the bile or the pancreatic duct. As we know, there is a bile duct coming with the pancreatic duct and joining into a pillar of Viter. So if the patient having carcinoma in the head of the pancreas, even if he undergoes a Whipple procedure, it will not be that much helpful for the patient. And if the carcinoma is in the head of the pancreas, the patient will be presenting with symptoms late or at a higher stage. Again, adenocarcinoma of the pancreas, extensive infiltration, sparing the unisate process. Unisate process, this one. Again, adenocarcinoma of the pancreas is here, destructing the normal parenchyma of the pancreas. Most common risk factor is smoking. Some literature say that diabetes is also a risk factor, but that's not a fixed. This is the appearance of adenocarcinoma. Adenocarcinoma means gland formation. So this is adenocarcinoma of the pancreas. This is also a small gland forming. It's also, again, adenocarcinoma of the pancreas. This is poorly differentiated adenocarcinoma of the pancreas in a collagenous stroma.